Good afternoon. My name is Derek Enlander. I'm a physician and immunologist practicing at Mount Sinai Medical Center in New York. It's April the 1st, 2020. We're now several weeks into the COVID-19 coronavirus pandemic. It's a catastrophe. In New York, 1,000 people have died so far from this virus. COVID-19 is an RNA coronavirus, perhaps related to the SARS virus, the severe acute respiratory syndrome virus that caused an epidemic in 2002. COVID-19 is a highly infectious RNA virus that rapidly replicates. It attacks primarily the respiratory system and produces symptoms of sore throat, fever, breathlessness, and peculiarly loss of taste and smell. The onset can be rapid. The patient can actually enter an emergency room and rapidly actually be then transferred to an ICU, intensive care, and put on artificial ventilation with a ventilator. A large number of patients actually have been exposed to this virus. 80% of the patients who are exposed do not actually have symptoms, but remain actually as carriers of the condition. The problem is that the patients actually who are carriers can transmit the virus by droplet caused by coughing or sneezing. So therefore a mask can actually prevent the person who has exposure to the virus to transmit it to another. The government has suggested actually that patients actually should stay at home, and the people actually who have to actually be out and about should actually remain 6 to 8 feet from each other. There should be no crowd or gathering in which the virus actually can be spread. Treatment of COVID-19, there is no proven treatment. There's no antiviral, no antibiotic. There is no vaccine. There are no proven methods of treatment. There are anecdotal ideas of treatment using hydroxychloroquine, which is an anti-malaria drug. Some people have thought that this actually might give some symptomatic relief. Also, remdesivir, which is a drug that was used in the treatment of Ebola experimentally, has actually been suggested. COVID-19 stimulates the production of cytokines, including interleukin 6, IL-6, which causes actually a reaction in the cellular mechanism of the respiratory system. The effect of the virus is relatively rapid in patients actually who are succumb to obvious symptoms. 80% of the patients, however, who are exposed to the virus do not exhibit symptoms, and actually it's thought develop antibodies to the virus. Close contact with others spread the virus. as I said, government actually in various countries have actually regulated the problem by keeping actually patients from large assemblies. The spread is through actually aerosol droplet, and inhalation of these droplets actually then actually spread the condition. Patients actually who recover from the infection are thought to actually maybe produce antibodies in the blood, and it is has been suggested that these antibodies can actually be harvested from these patients who recover and perhaps used as treatment of the disease in patients actually who newly are suffering. This actually is a method that was used in the 1918 Spanish flu epidemic. Tests for the presence of COVID-19 have been a subject of discussion, and there have been earlier tests for the actual presence of the virus antigen. These have actually been subject to discussion as to their accuracy. About 2 days ago, Henry Schein, a clinical supplier, came up with a test that can be done in a doctor's office and produces results within minutes to show the presence of antibodies to the COVID-19. Presence of these antibodies will then suggest that the patient actually has been exposed sometime in the, previously to the actual virus, and the physician can then actually correlate the patient's condition versus actually the exposure. This hopefully actually will be a good breakthrough in the treatment of this condition. Improving the immune response may be a direction actually that we can look at, and that can actually perhaps improve treatment results. If patients or anybody actually who has any questions, I, like most other doctors, are making themselves available to answer any questions or problems that have existed. You can call me at 212-794-2000, and I'll only be too pleased to try and help. Thank you very, very much.